Hello everyone, this is a continuation of the lectures in HIM 225 for Chapter 22. If you will, turn to page 535 in your textbook, and we're going to start going over these guidelines. And the first guideline basically tells us that obstetric cases require codes from Chapter 15. It gives us the code range, which you can see on the screen as well. And that Chapter 15 codes have sequencing priority over codes from other chapters. And you'll see that clearly documented in some of those other chapters, that if it's pregnancy, the principal diagnosis has to be a code from Chapter 15, and then you'll add a code from that other chapter. Additional codes from other chapters can be used in conjunction with Chapter 15 codes to specify the conditions. For instance, if an OB patient has pneumonia, you'll have an obstetric code that tells you have a pregnancy complicated by an infection, and then you'll actually have the code for the specific type of pneumonia as a secondary code. If the provider documents that the pregnancy is incidental to the encounter, then we use code Z33.1, pregnancy state incidental. And that is used in place of any code from Chapter 15. If you're using Z33.1, you cannot use a code from Chapter 15. Likewise, if you're using codes from Chapter 15, you are not going to use the code Z33.1. But in most cases, if a patient is pregnant, then a code from Chapter 15 must be assigned regardless of what condition the patient presents with. The exception would occur if a physician documents that the pregnancy is incidental. Almost always, codes from the pregnancy chapter are going to be assigned. This doesn't mean that codes from other chapters can't be used to more fully describe the condition, but codes from Chapter 15 do take priority. Let's look at this first example. The patient presents to the physician's office with pain and burning on urination. The physician documents that the patient is 26 weeks pregnant and has a UTI. So, in the index, we're going to put in pregnancy complicated by, and if you try to put in urinary tract, you won't find a subterm for that. You have to put in infection and then come down to urinary tract. And you'll see that the code in the index is O23.4. So when we come over to O23.4, you see that we now have to choose the trimester. Many of the codes in this chapter require that you select the appropriate trimester. You'll notice that O23.40 is the code for an unspecified trimester. It would be very unusual for you to use that code. If you have a patient that's in the hospital and pregnant, they are going to be documenting probably not only the trimester, but at the weeks and the days. So that is a code you may never use. In this, if we look at this, our patient is 26 weeks. Okay, so what weeks is 26 weeks? Well, the second trimester on page 546, it tells you that the second trimester is 14 weeks, 0 days to less than 28 weeks, 0 days. So she's 26 weeks, so she is going to be in the second trimester. And you'll notice that it's the second trimester, and that seventh character is a 2. It's 1 for the first trimester, 3 for the third trimester. So O23.42 is that code. Now, we need to code her week's gestation. So we can do that by going to pregnancy and then weeks of gestation, and when we come down 26 weeks is Z3A.26. And if you look, all of these weeks, it's Z3A, and then the weeks all have the final two characters as the weeks. There's one for greater than 42 weeks, less than 8 weeks, or not specified. And of course, if we go up to 8 weeks, Z3A.08. So we're at Z3A.26. In the next example, we have a patient with gastroenteritis who's seen in the ER. The ER physician documents that the pregnancy is incidental to her gastroenteritis. So we are applying the code for the gastroenteritis, K52.9, and then we are applying the code for pregnancy incidental, and then incidental, Z33.1. Now again, your book talks about the fact that codes from Chapter 15 are only used on the maternal record. They are never used on the record of the newborn. And then your book does go on to say sometimes it's confusing to know what is reported on the mother's chart and what's reported on the newborn chart. Your book tells you it's possible it may be helpful if you're coding both charts at the same time. And it goes on to say that if a pregnant woman has a UTI and that affects the care of the newborn, the code of 023.42 would not be used on the newborn chart. There is actually a code P00.1, and that's what would be assigned from the newborn chart, and of course that code is found in the index. So again, these codes from Chapter 15 do not go on newborn charts. Now, the next guideline that we are going to talk about is we talked about this, final character for trimester. So we actually have already talked about that. Now, your book, there are instances when a patient can come into the hospital for a complication of pregnancy during one trimester, maybe the second trimester, and then they remain in the hospital into the subsequent trimester. So maybe they come in at 27 weeks, 2 days, and at 28 weeks, 4 days, they go home. Well, the trimester character for the antepartum complication is assigned based on the trimester when the complication developed, not the trimester of discharge. If the condition developed prior to the current admission or represents a pre-existing condition, then the trimester character for the trimester at the time of the admission or encounter should be assigned. So, if it was pre-existing or they came in with it on admission, then you assign the trimester that they were in at the time they were admitted. Now, it tells us every category has an unspecified trimester. We've talked about this. We probably will never use that code. And this example that we have, patient in third trimester of pregnancy is admitted with oligohydramnios. So this doesn't tell us how many weeks gestation, just the fact that she's in her third trimester. So we're going to say pregnancy. So in the index, we have put in pregnancy complicated by oligohydramnios. And we can see that the code is 041.0. So we are going to verify down the tabular. We need to choose the fact that this is the third trimester. So we're at 041.03. And this requires that we add a seventh character. If we look up, now we have this, we have to choose which fetus is affected. Now I want you to look carefully at this. This is a guideline. we use the seventh character of 0 if it is a single gestation and for multiple gestations where the fetus is unspecified. The characters 1 through 9 are for those cases of multiple gestations and to identify the fetus to when the code applies. So, for instance, if a mother is having twins, she may have been having ultrasounds, and they have identified one of those fetuses as fetus 1 or fetus 2. And there is maybe a condition that one of those fetuses has, and when the patient comes into the hospital, they have a diagnosis that requires the application of this character designated the fetus. That may be documented. However, I'm not sure that these fetus character codes are used consistently, and they are not used in our textbook. So for our example, this patient, this is a single infant. So we are going to be applying that seventh character of 0 excuse me, to our code. So we have 041.03, and then we have to have the placeholder of X, and then we add a 0. Now, the other thing we have to do is assign the week's gestation, and we don't know the week's gestation. So when we in the index, when we go to week's gestation, we know that not specified, we assign that code Z3A.00. Now your question for this lecture is to go to exercise 22.1, 22-1, exercise 22-1. You'll be answering questions 15 and 19. And so you will actually go to that assignment and open it, and these are multiple choice questions that you will answer. And that will conclude this lecture.